This is a University of Sheffield Health Service screencast. This screencast aims to answer the question, what level of treatment can I expect on the NHS in England? If you are unsure of what the NHS is, or who we are, the UHS, please click on the globe of flags as shown to be taken to our video dedicated to this. There are strict rules on levels of NHS treatment available to visitors to England, particularly for hospital treatment. At the University Health Service, we apply these rules to our registrations too. However, ultimately, it is at our discretion who we choose to register at the UHS. There are 3 levels of treatment available on the NHS in England: full treatment, some treatment, and minimal treatment. Full treatment on the NHS is available for the following people. Firstly, anyone who is ordinarily resident in the UK. The government defines this as someone who is living lawfully in the UK voluntarily and for settled purposes as part of their regular order of their life for the time being. They have an identifiable purpose for their residence, which has a sufficient degree of continuity to be properly described as settled. Secondly, those studying more than 6 months on a full-time course are eligible for full treatment on the NHS. As are students whose course is funded substantially by the UK government. We understand that substantially means at least 35% government funded, although we would urge you to check this with your relevant authority prior to coming to the UK. Students will need to provide evidence of this funding to qualify. If you qualify for this level of treatment, your dependents will similarly be covered. Dependents are defined as your spouse or civil partner, and children under the age of 16 or 19 if in further education. Dependents must live with you permanently while you're in the UK for the duration of your course. For students and their dependents who fall into this category, we would encourage you to fully register with the UHS on arrival. Please note that we will only register dependents if they live within our practice boundary. For more information on this and how to register, please click on the big green button. Next, let's move on to those who qualify for some treatment on the NHS. Students whose course lasts less than 6 months will qualify for some NHS treatment if they come from a country that holds a bilateral health agreement with the UK. The level of treatment is generally only for any condition that has started since arrival in the UK and needs prompt treatment. We'll now go through which countries are currently covered by the bilateral health agreement, but we would advise you to check the up-to-date list by seeing the reference page at the end. Nationals of the European Economic Area are eligible for some NHS treatment. You will be asked to show proof of eligibility in these circumstances, such as your E128 health insurance card. For other countries with a bilateral health agreement, we will usually ask to see your passport. Nationals of and UK nationals in the following countries are also eligible for some NHS treatment. Please see the list below. And finally, residents, irrespective of nationality, of the following countries will be covered by the bilateral health agreement. Please see the list below. For students who fall within this category and their dependents, if they live within our practice boundary, we would only register you temporarily for treatment at the UHS at the time of illness. You can register by filling out a simple form that we will give you when you attend the health service. We would strongly encourage you to purchase medical insurance before coming to the UK for you and your dependents in case if you require treatment that isn't covered by the bilateral health agreement. If you aren't eligible for full or some treatment on the NHS, you and your dependents would only be eligible for minimal treatment on the NHS, which is available to any visitor to England. This includes treatment given in an accident emergency department. This excludes emergency treatment given elsewhere in the hospital. Treatment given in a walk-in centre providing similar services to those of an accident and emergency department of a hospital. Treatment for certain communicable diseases. This excludes HIV or AIDS, where it is only the first diagnosis and connected counselling sessions that are charge-free. Compulsory psychiatric treatment, and family planning services. If you or your dependents need treatment above this level, you will usually be asked to pay. At the UHS, we will only temporarily register those who require prompt treatment for a condition that arose since arrival in the UK. We can otherwise give you the details for private doctors in the area. We would strongly encourage you to take medical insurance prior to coming to the UK for both you and your dependents if you only qualify for minimal NHS treatment. For up-to-date information on eligibility for different levels of NHS service and bilateral health agreement countries, please allow the annotations on this video. Remember, you can catch up on all the latest UHS news on our Twitter page at twitter.com/SheffieldUHS. This is the end of this screencast.